Patients with complex arrays of chronic conditions are spending less time hospitalized, if at all, thanks to a special wing at the Peter Lougheed Centre. The Complex Chronic Disease Clinic is able to give patients referrals to specialists and help manage their conditions and medications.
We're talking about patients where even the slightest change in their health status can cause quite a significant deterioration, and they're going to the emergency department, having to wait 8-12 hours to then be assessed and then likely admitted for several weeks and restabilized and discharged back only to repeat the cycle again. So what we're really providing in terms of support for these patients is the ability to break that cycle.
Since the clinic opened in 2008, hospital admissions for patients that are seen here have reduced by 60%. Meantime, the number of days spent in hospital by those patients that still have to be admitted has dropped by 90%.
The clinic has made a huge difference for 67-year-old Douglas McKay, who suffers from obesity, gastrointestinal issues, heart failure, lung failure, and severe arthritis. He also lost the ability to walk inexplicably following a bout of pneumonia. But cutting the number of doctor's appointments from up to 5 a week to just 1 a month has had an extremely positive impact on his lifestyle and that of his daughter, who is his full-time caregiver.
Before, I would always have to make an appointment with my GP, and she would then refer me to a specialist, which may take a month or 6 months or whenever they got around to getting your appointment. Whereas now, all I do is every month they usually have an appointment with them. I come here, and everything, all the specialists that I went to before are all handled by Dr. Scott.
It was really hard to meet all the appointments and be everywhere, but going once a month and getting it all in one place, the x-rays, everything, from his draining of his lung to whatever we need. It's all done on one visit.
Dr. Scott said the referral-only clinic is also helping reduce pressure on emergency rooms by overseeing patients that would otherwise demand a lot of time and services. For Sun News, I'm Jenna McMurray.